Assalamu alaikum and good morning to one and all. Today we'll study about part 2, that is symptom and management of heavy metal poisoning. So before going ahead, let's quickly see what we have studied in part 1 of this chapter. So in part 1, we have studied about symptom and management of lead poisoning. So out of different heavy metal, so in part 1 we have studied the lead metals and we have seen how it produces acute and chronic toxicity and how we can manage the treatment of lead poisoning. At the end of this e-learning session, you are able to explain symptoms of mercury and arsenic poisoning, discuss its treatment and management. So what are the different forms of mercury and how mercury it produces the mercury toxicity. So remember that the mercury, it is one of the heavy metal and it is an important constituent of many drugs for a century. Since it is present in a drug, especially in case of the Ayurvedic formulation, where source it is from the herb, and also mercury it is at itself it is used to certain extent for the treatment of some of the disorders. So mercury it is an important constituent of many drugs for the century. But drug-induced mercury poisoning, it is very rare, and we'll see later on what is the reason why drug-induced mercury poisoning it is a rare. However, mercury has a number of important industrial uses. Since it is used in the industry, so the person who is work in the industry, he may expose to the different sources of the mercury, and poisoning from occupational exposure, that is when he is working in particular industry where mercury is being used, and if he is exposed to that, then in such case this exposure it is called as occupational exposure. And sometimes the exhaust which is coming from the industry, it is released into the environment. When this exhaust it is released into the environment, this may lead to the environmental pollution, right? And the person, if he stay somewhere at the place which is nearby such industry, he may daily get exposed to the source of the mercury, right? So the poisoning it is generally from occupational exposure and environmental pollution, which is continue to be an area of concern. So if you know that you are exposed to such type of mercury due to the occupation, then one way only is to avoid mercury poisoning. You can change your occupation, or you can take all preventive measure to avoid exposure or entry of that mercury into your body. Like suppose you can use the mask. So if the mercury it is through in the form of the vapor, if it is coming getting to you, you must use proper mask. Likewise, in case of environmental pollution, if you stay somewhere, if your residence which is close to such industry, then every time staying in the mass it is not feasible, then in such case it is advisable to change your residential area. So instead of staying at the place which is close to such residential area, you can move on to the place where there is good air is there, good ventilation is there, and which is not polluted with such mercury pollutant. Okay, so this could be the source of exposure to the mercury. Now let's see what are the form of mercurial metal. So there are two major chemical form of mercurial metals, and we must distinguish these different chemical form of the mercurial metal. So first form, it is mercury which is present in the vapor form. So do remember that the mercury which is present in the vapor form, it is called as elemental mercury. So mercury which is present in vapor form, it is called as elemental mercury, and obviously the source of such exposure it is through the environment, the air which is polluted with the mercury, and if you inhale such air, you may suffer from elementary mercury poisoning, right? Second could be the salt of the mercury. So the salt of mercury it is specifically present in the liquid form, and if you consume anything which is contaminated with the salt of the mercury, then you may also suffer from mercury poisoning. And last form, that is third form, it is organic mercurial. So there are three forms of the mercury, and based on which form you are exposed to, it may produce different types of symptoms. So let me correct here. It is not two forms. There are actually the three forms of chemical mercury. Okay, so there are three major chemical form of mercurial metals, it is generally present. The point of the mercury poisoning, or important form which produces the mercury poisoning, it is the mercury vapor, which you may expose to, and generally it is volatile in nature. So elementary mercury, since it is the most volatile form of the mercury. What do you know volatile form? Suppose if it is present in a liquid form, because you know that mercury it is present in a liquid form. So from liquid to the vapors, it is quickly converted. So since the speed of conversion, it is very quick from liquid to the vapor, it is called as most volatile form of the mercury. So it is very dangerous, because what happens now, when you are working with the mercury, it may be present in the liquid form. But since some of the amount it is quickly converted due to its volatile nature, it is quickly converted into the vapor, and in such environment, when you inhale, the patient may suffer from mercury poisoning. So the point of concern, or the main our concern of the form of the mercury that we have to see, it is in case of mercury vapor, or that is the elemental mercury, where we need to exercise special precaution to prevent exposure of this mercury or entry of this mercury from environment into our body. Okay. So human exposure to mercury vapor, it is mainly occupational in nature, obviously, because if person is working in the industry where such volatile mercury or elementary mercury, it is released into the air, and if you inhale such air, then you may suffer from the mercury poisoning. So this is about the elemental mercury. So as I have mentioned, elemental mercury, it is present in the liquid form, and since it is most volatile, so it will be quickly converted from liquid into a vapor form. Okay, so the elemental mercury, so when it is present in the liquid form, and suppose if it is ingested, so suppose someone has ingested or maybe taken the food which is contaminated with the mercury in the liquid form, then this mercury, it is mostly non-toxic in nature. Why it is non-toxic? Because the elemental mercury which is present in the liquid form, it has very low absorption from your GI tract. Since it having very low absorption into GI tract, most of the mercury will be excreted as such into your feces. Okay, so from the feces it getting excreted, and since it is excreted from the feces, it produces very low or very less the toxic effect. So almost it is the non-toxic because of very low absorption from the GI tract. Let's see what are the effect of the mercury. So obviously, as I have mentioned, in the liquid form, when you consume the mercury, it may not produce toxic effect, but most concerned form of the mercury, it is the vapor form of the mercury. So when you expose to vapor form of the mercury, where first mercury it is going, so through vapor, when you inhale those vapor, it will goes into your lungs, right? And you may suffer from lungs toxicity. So lung toxicity in a scientific term, it is called as pulmonary toxicity, right? So this pulmonary toxicity at initial stage, it may progress into interstitial pneumonitis. What do you mean by pneumonitis? If there is inflammation in pulmonary alveoli, right? And this inflammation, it reduces the capacity of your alveoli to accommodate the air, right? So this is called as interstitial pneumonitis. So initially there is just pulmonary toxicity which may progress to interstitial pneumonitis with severe compromised respiratory function. Obviously, when the alveoli, the space it is reduced. Suppose if these are the alveoli space, and if there is inflammation, so due to inflammation, the alveoli capacity to accommodate air will reduce, and the patient may suffer from the breathing problem, right? So it may compromise the respiratory function, and it doesn't stop here, but it further produces the further complication where patients suffer from very severe problem of the respiratory system. Okay, so this is happen in case of acute exposure to the mercury, whereas in case of the chronic exposure to the mercury vapor, it produces a more insidious form of toxicity. What do you mean by insidious form? The toxicity, if it progress gradually, means slowly progressing, Like maybe today you may expose to very small dose of the mercury, you may not immediately see their effect, but maybe after a month of continuous and slow exposure to the mercury, slowly you may see there is compromised respiratory function, right? So it is not suddenly happening, whereas in case of acute disease we can see there is immediate interstitial pneumonitis, because you expose suddenly to the high dose of the mercury. Since you expose to high dose of the mercury, you may suffer from interstitial pneumonitis with severe compromised respiratory function. But here in such case, you expose to very low dose. Since you expose to very low dose of the mercury, you are not immediately showing the sign and symptom of mercury poisoning, but it is insidious in nature, the toxicity which progress very slowly, and then it further dominated by neurological effect. So initially when you have exposed to the low dose of the mercury, you may see the some symptom of respiratory function, but after that the most of the symptom which are related to your neurons, so the neurological effects are dominated as compared to the effect on the respiratory system. Okay, so to summarize, the overall effect it is on the respiratory system. In case of the acute overdose, it produces interstitial pneumonitis with severe compromised respiratory function, whereas at chronic exposure to mercury vapor, it produces the more insidious form of toxicity which is dominated by neurological effects. Let's see how we can give the treatment. So the treatment of mercury poisoning. So the treatment of mercury poisoning, it's depend upon the symptoms and the extent of the mercury poisoning, right? For example, the patient is suffering from high level exposure and the patient show the symptoms, and it means it is the patient is symptomatic. So high level exposure or symptomatic patient, you need to give the chelation therapy with dimercaprol. So when you are giving dimercaprol, when patient having high level exposure or he is the symptomatic in nature, and that we have seen it is happen only in case of the acute overdose of the mercury poisoning. It doesn't happen in case of the chronic mercury poisoning, because chronic mercury poisoning the symptom develops slowly. So at initial level there are no symptom. Okay, so in case of acute overdose where there is high level exposure or and patient show the symptom and is symptomatic in nature, you can give chelation therapy with the dimercaprol. So this is the first way of giving the treatment. Second thing, if patient having the low level exposure or he is asymptomatic patient, means he is exposed to mercury, means you know that the patient is working in the mercury industry where no matter how much precaution you are taking, but to certain extent you are exposed to the low level or low dose of the mercury. So low level exposure or and obviously the low exposure to the mercury will not produces the symptoms, so that patient is asymptomatic patient. So low level exposure or asymptomatic patient, you can give the penicillamine. Okay, so there are two drugs basically you are giving, either dimercaprol or penicillamine. So when dimercaprol it is to be preferred when patient is exposed to high level of the mercury and he show the symptoms, right? And you can use the penicillamine when patient having the low level exposure to the mercury or the patient is asymptomatic in nature. In such case you can use the penicillamine. So the dimercaprol mercury chelate, it is excreted into both bile and the urine. So when you are giving treatment with dimercaprol, the most important thing is how it is getting excreted, because once the dimercaprol it form complex with the mercury. Now what must be the next part? So next part, it is the removal of this mercury from the body. Okay, so the dimercaprol mercury chelate, it is excreted into both bile and the urine. So what this indicate? So anything which is excreted into the bile, it will be excreted into the feces. So that important point that you must remember. Okay, whereas anything which is excreted into the urine, obviously here it will be excreted with the help of your kidney. So here the kidney it play a very major role. Okay, so the dimercaprol there is no problem because it is excreted both by the stool as well as the urine. Whereas In case of penicillamine mercury chelate, so the complex which is formed by the penicillamine with the mercury, this chelate or this complex, it is excreted only into the urine. Since anything which is excreted only into the urine, it is a matter of concern in the patient who is suffering from renal function impairment, right? So if any patient who is suffering from the kidney impairment or his renal function it is impaired, then in such case what will happen? Since it is only excreted into the urine, it will not be excreted because their kidney it is already been compromised, their functions are already been impaired, right? So the penicillamine should be used with extreme caution when the renal function is impaired. So before giving penicillamine for the mercury poisoning, you must see the GFR, that is glomerular filtration rate. If it is in the normal range, then you can give the penicillamine. Otherwise, what will happen? Penicillamine, yes, it will form the complex with the mercury. It won't allow mercury to bind with a different tissue. But problem it is with the excretion of penicillamine mercury chelate. It won't get excreted and it may produce further complication. So when you are giving penicillamine mercury chelate, you must take the precaution. Penicillamine should be used with extreme caution when there is renal function it is impaired. Next thing, we have seen in case of lead, we have used the disodium EDTase, we have also used calcium disodium EDTase. But remember that the calcium disodium EDTase, it does not work in case of mercury poisoning. Now let's see why calcium disodium EDTase not work in case of mercury poisoning. So this is the reason. First thing that you must identify what type of poison is. If it is lead poisoning, there is different treatment. If there is mercury poisoning, there is different sort of treatment. In case of mercury, you cannot give calcium disodium EDTase. Whereas in case of lead poisoning, the first drug it is that you are giving or the first chelating agent you are using, it is calcium disodium EDTase. So let's see the reason. So the mercury poisoning does not respond to calcium disodium EDTA despite the fact that mercury displaces calcium from calcium disodium EDTase in vitro. So this is very interesting. So when you are mixing your calcium disodium EDTase along with the mercury, so mercury you write as specifically it is denoted by the Hg. So Hg it indicates the mercury. So when Hg, that is mercury, when you are giving with the calcium disodium EDTase, it replaces the calcium. Since it replaces the calcium, it quickly form Hg EDTA complex. Okay, and it will also replaces the sodium. So since calcium is also there, sodium is also there, so it will replace more calcium, more sodium, and there will be the more chelation between mercury and EDTA. So when you give this in vitro and when you mix the calcium disodium EDTase along with the mercury, you see that this calcium disodium it is immediately replaced and the mercury it form complex with the EDTase. But when you are giving in vivo to the patient, so in vitro you are mixing in test tube maybe, right? You are not giving to the patient. But in vivo, when you are actually giving to the patient, it does not form this complexing agent, it does not form the chelation. Now why it does not form the chelation? Because the mercury it is unavailable to the chelation. Now let's see why mercury it is unavailable for calcium disodium EDTase for the chelation when it is given in vivo or when it is given to the patient. So remember that when it is given to the patient, the mercury it is present in tightly bound form to the SH group in our body compartment. So the SH group it is present in our body tissue. So this mercury it immediately after going into the body it form very tight complex or there is formation of very tight complex between mercury and SH group of our body, right? So in our body there is formation of this complex, and since this complex it is formed or once this complex is formed, the calcium disodium EDTA will not able to replace this complex. Now mercury, since it having more affinity towards SH group as compared to calcium disodium EDTase, it remains in bound form only to the SH group in our body compartment. So this is the one reason. Second interesting reason is that this calcium disodium EDTS does not penetrate our body compartment where the mercury form very tight complex with the SH group. So there are two reasons. First thing is that the complex form between the mercury and SH group in the body compartment, it is very covalent in nature. Means it form very tightly bond complex. Second reason, calcium disodium EDTS, it does not penetrate the body compartment. So since it is also not penetrating the body compartment, now this mercury, it is not available for chelation to calcium disodium EDTS. So this is very interesting. So although mercury, it forms the complex with calcium disodium EDTS in vitro, but it does not form complex in vivo, and that is the reason why calcium disodium EDTS not work in mercury poisoning, and you are not giving to the patient suffering from mercury poisoning. Okay, so we are using two treatment, penicillamine and dimercaprol. So I have done with my first part. Let's go to the next part of today's session. So next heavy metal which may produce the toxicity, it is the arsenic. So arsenic, it is found in different part of the environment, like it is present in your soil, it is present in the water, and it is also present in the air. So obviously the source of arsenic poisoning could be the soil. So the vegetable, if you are not properly washing it, and then you may get some trace of the arsenic or dose or some source of the arsenic. Sometimes arsenic, if it is present in the water and if you drink that water, then also you may expose to the arsenic. And obviously the last source that is very common with all three heavy metal, that is lead, mercury, even with the arsenic, it is the air. So the air as the common environmental toxicant. Let's see what are the symptoms of acute arsenic poisoning. So let's see how it start and how it progress. As we have seen, most of the time in case of arsenic poisoning, the source, it is through the consumption of the arsenic, whereas in case of mercury, through the inhalation, because when you consume mercury in the liquid form, it having less absorption. So since it having less absorption, it may not produce that toxic effect. But in case of the arsenic as well as the lead, when you consume, it absorb, and since it absorb, it may produce different systemic effect. Okay, so in case of arsenic poisoning, effect, it even start with their local action on the GI tract. So initially when you consume the arsenic or any food or the water which is contaminated with the arsenic, then you may initially suffer from GI discomfort. So GI discomfort, it is experienced within an hour of exposure to the arsenic, right? So within an hour of after intake of the arsenical, so arsenical, it is the source of the arsenic. Then you may suffer from initial symptom like burning in the lips, because whatever you have consumed, the water you may have drank, it contains the arsenic, and when your lips are exposed to this arsenic, you may suffer from, or you may show the symptom of burning in the lips. So there is burning of the lips, then constriction of the throat, and difficulty in the swallowing. So these are the important symptoms, or maybe the first symptoms or the early symptoms which are related to the arsenic poisoning. So the GI discomfort experienced within an hours after intake of the arsenical, then burning lips, constriction of the throat, and difficulty in swallowing may be the first symptoms which are related to acute arsenic poisoning. Then it is followed by severe gastric pain. So there is the very severe gastric pain. The patient show the vomiting, and he may suffer from severe diarrhea. So these are all local effect, means the arsenic not enter into the blood circulation, it is still in your stomach, and it's showing effect on your gastrointestinal tract. In addition to this, when arsenic, it is absorbed into blood circulation, the first part or first system of the body it affect, it is your kidney, right? And it show the symptom like oliguria. Oliguria means since due to the impairment of the kidney by the arsenic, you may suffer from only few urinary output. Suppose you have 7 to 8 urinary output in a day, maybe your urinary output is it reduced to 2 or 3 urinary output for a day, or you may even suffer from difficulty in the urination, right? So initially patients suffer from oliguria with presence of the protein in the urine. That condition it is called as proteinuria, and also there is presence of the blood. So there is a red color urine, or that urine containing the blood and the protein. So this is the characteristic features of arsenic poisoning. So oliguria with proteinuria and hematuria usually present, and eventually patients suffer from anuria. Means initially there is only few urinary output, and slowly it may progress to no urinary output and patient unable to urinate. So that could be the problem. Maybe you need to use the cannula and the tube to remove the urine from the bladder, because on himself he will not able to urinate due to the problem of the proteinuria, hematuria, and the attack of the arsenic on the kidney cells. Okay, so this is the another symptoms of arsenic poisoning. In addition, in the skeletal muscle, it produces the skeletal muscle cramp. It produces severe thirst. That is, we have seen in case of lead poisoning also. The lead poisoning, the lead it contained in the water. Likewise, arsenic also contained in the water. And when you drink such water, your thirst will not get satisfied. Rather, it produces more thirst. So when you take the water, generally your thirst must be satisfied. But if it contains heavy metals, and as I have mentioned, it may present in the tanker water. So if you drink the water which is coming from the tanker, most of the time it contains these heavy metals. Okay, so you suffer from the severe thirst. The symptom of the shock will slowly start appearing. So as the dose of mercury it get increased, it may progress to different level of symptom with the arsenic poisoning. In addition, patients show hypoxic convulsion, he showed the coma, and in very severe case, patient may suffer from the death. So there could be the possibility of death of the patient. So the arsenic poisoning should not be taken lightly, because it is life threatening and it will lead to death of the patient. Whereas in case of these are the symptoms related to acute arsenic poisoning. Let's see what are the symptoms of chronic arsenic poisoning, and very interesting symptoms are there. So in case of chronic arsenic poisoning, where you get low and gradual dose of the arsenic, you may show the different symptom, where the sign and symptom that should arouse suspicious of arsenic poisoning, it include the muscle weakness and the itching. So the patient suffer from muscle weakness and there is the itching in your skin. You may suffer from the skin pigmentation, especially on the neck. You may see the many patient having skin pigmentation on the neck. So the arsenic poisoning, it is one of the reason. And there is the pigmentation on the eyelid. There is hyperkeratosis, and also the patient suffer from the edema. In addition to this, the very interesting symptom, it is the garlic odor. So garlic odor of the breath and perspiration, like the sweat which is coming to you, and this, after the sweating, and also in case of the breath, there is the garlic odor. So the garlic odor, it is very interesting and characteristic feature of arsenic poisoning. So if you are having chronic exposure to the arsenic, he may suffer from garlic odor to his breath as well as perspiration. In addition, there is excessive salivation, excessive sweating, and there is generalized itching, because through the sweating, the arsenic it is coming out, and your skin it is exposed to the arsenic, dose of the arsenic, and it produces the itching on the skin. So then he may suffer from sore throat. There is lacrimation. What do you mean by lacrimation? Lacrimation, it is excessive, the tearing from your eye, it is called as lacrimation. So there is excessive lacrimation is there for no reason. Then numbness in different part of your body, the burning or tingling of the extremity, your extremities, like your hands and your feet, there is very severe burning and tingling sensation. So these are the different symptoms which indicate that patient has the chronic dose of the mercury, or he is exposed to the chronic dose of the mercury. So we have seen the acute and chronic symptom of the the arsenic poisoning. Let's see what is the treatment and how we can treat the patient suffering from the arsenic poisoning. So the drug which is given, or you can start the treatment with the dimercaprol. So dimercaprol you can give 3 to 4 milligram per kg intramuscular every 4 to 12 hours. Okay, so dimercaprol 3 to 4 milligram per kg. The dose given it is intramuscular, and you are giving every 4 to 12 hours until abdominal symptoms subside. What are the abdominal symptoms? We have seen which is happen at initial level, like it start even with the burning sensation in your legs, right? And when you go to the abdomen, you suffer from very severe abdominal cramp, vomiting, and the diarrhea. These are the abdominal symptoms. So you can give dimercaprol 3 to 4 milligram per kg. How you can give? You are giving through intramuscular dose, and you are giving for every 4 to 12 hours until abdominal symptoms are subside. When there is no vomiting and the diarrhea. Once these abdominal symptoms are reduced, then you can give the oral penicillamine. Now you can see how you are giving the treatment. So initially through injection, intramuscular injection, 3 to 4 milligram for every 4 to 12 hours until abdominal symptoms are subside. And once these abdominal symptoms are reduced, now you can use oral penicillamine, may be substituted for dimercaprol, and it continue. So the dose of penicillamine through oral route you are giving for 4 days. So you are continuing for 4 days so that you ensure there is complete removal of the arsenic from the body. So this is how you can treat the patient suffering from the arsenic poisoning. I have done with my today's session. So this chapter, that is part 1 and part 2 of arsenic poisoning, I have referred Goodman and Gilman, Manual of Pharmacology and Therapeutics, page number 1130 onwards. Again, thanks for watching. If you like my session, then do remember to give me a thumbs up. And for more such learning, subscribe to my channel.